Our next presenter, we're just moving to a slightly different topic. We're going back to students. This is Dr. Prestmo from the University of Bristol. You're going to see a lot of people from the University of Bristol. So that's the end of the Illinois contingent. Now I think it's a lot of Bristol folk, or with some connection to Bristol anyway. So, and Pia's going to be talking about the use of sort of student data and student learning and how that was useful to clients from Abattoir. So welcome.
Many thanks. So, yes, I'm based in the UK and very happy to present this study that I'm doing together with my supervisors, Adrian Klink and Andy Grist, which we've chosen to call Abattoir Feedback from Veterinary Students as a Tool for Herd Health Improvement. Just a little bit about the background for this study. Those of you who have been following recent politics know that this might change. But for now, we are still doing meat inspection as dictated by EU legislation. And from those of you who are not familiar with this legislation here, it tells the vet in the abattoir basically how to do an official control, down to the level of which lymph nodes to cut, which organs to palpate, and all animals slaughtered undergo meat inspection according to this legislation. And the legislation also states that conditions that are found at meat inspection have to be recorded by the official veterinarian if they might affect public or animal health or compromise animal welfare. So very wide definition of what has to be recorded, but also I want to just emphasize that the responsibility of this is placed on the OV and in the vet who is in the slaughterhouse. So we think that there is great potential of using this data. In the UK, these things are recorded, but very often don't reach the producer. They don't reach the person who might make use of this data. And at the University of Bristol, we do a one-week public health rotation. We've got students coming to perform ante and post-mortem inspection, and they write a case report. They do this for one batch of animals, and along with the case report, they write some advice to the farmer based on whatever they found in their inspections. And we send this advice to the producer by post. And this is a new thing that we've done for about a year, and we are really happy with the way things are going, because previously students have come to this rotation and kind of had the mindset of, okay, I just need to see this, and I can tick the box and say, I've been to an abattoir, I'm going to the clinic. So we wanted to change this so that the students are more actively involved in actually doing something. And we're seeing a nice change in the students' attitude and getting some good feedback from them as well. You can see them here with their clipboards, which we tell them is what you need if you want to look important, especially in a slaughterhouse. So the aim of this study was to investigate if and how this student feedback that we send to the producer is being used by the producer themselves, and also because the students, let's say they have found some liver fluke, they will explain the life cycle of this as well and try to provide some education on the condition they found. We also wanted to know, does this contribute to the producer's knowledge of these common conditions that we see? And we also wanted to know, is this a useful learning experience of the students? Being a new thing that we're doing, we've changed the rotation, we've changed our teaching, we wanted to know what the students think about this. So far we've used the case reports that were written in 2015. We've got our own students, fifth-year Bristol students, writing case reports, and also Cambridge University send their students to our abattoir. But they are fourth year, so their level of knowledge is a bit different to the Bristol students. And these case reports contain information that the students have collected at ante-mortem and post-mortem, and they also do a welfare assessment. So they observe the stunning, the bleeding of the animals, and also what the lairage environment is like. Then we did a phone questionnaire among those producers who had received feedback, so the ones who had received a letter from the students. Sometimes we slaughter animals when there are no students in the abattoir, so not every producer is going to get a feedback letter. We also conducted an online questionnaire among those students who had taken part in this rotation, and that is still going on. So we had, for 2015, 41 feedback letters sent for 64 cattle. Some producers bring in one animal, some producers bring in 2, 3, and some producers bring animals every week. Some of them bring just one every few months. We are a very small abattoir. We cater to the small holders, mostly hobby farmers around the area, so that will obviously influence our results. Just to give you an idea of what we're seeing, it's not too exciting, unfortunately, but we are happy to at least find some liver fluke when that is in season, some pleuritis, pneumonia-like lesions. Those are the things that we are usually seeing. Also, sometimes remnants of liver abscesses. Usually, it's a great day if we find a liver abscess because we have something to show the students. But for cattle, the animals are disappointingly healthy. The response rate from the producers was 12 out of 18, so we asked 18 producers to take part in our study, and out of those I managed to get hold of 13, and we had one decline to take part, or his secretary basically told me he doesn't like paperwork, so the letter we had sent had gotten lost somewhere. But we're quite happy with the producers that chose to take part, to have that kind of response rate. So the first question we would ask them is how useful the information in the letter was, and we're really happy to say that the producers do think that is useful information in the letter. Common feedback would be, for example, we have found some active liver fluke, meaning actual liver fluke, that we can see present in the liver. The student will explain what it is and give some advice on how to manage this. And our next question, was this information new to you? This is something that we might change, because the question was designed to try and figure out if the producer had learned something from this letter. And most of them did say that the information was new to them. Some of them said no, it wasn't really new to them, because they weren't expecting there to be anything wrong with the animal when they sent it in, and that was what the feedback said. Did the letter contain suggestions for herd health improvement? And I asked this to the producers, and I asked, do you remember if there were any herd health suggestions? Where 5 producers did say that, yes, there was some recommendations, and 7 said that there wasn't any. Again, having very healthy animals, it's difficult to give feedback, and the students need usually some guidance in what to provide to those producers who didn't have anything wrong with their animals. So out of this group of 5 producers who had received some herd health suggestions, we asked if the suggestions were useful. And 2 producers said that it was very useful information. Those producers had received quite extensive feedback on liver fluke problems. 2 people said that they didn't really have an opinion on it, or one didn't have an opinion on the usefulness of it, and the other one said to ask me next year and I'll tell you if the suggestions worked. And the last one, who said that it wasn't very useful, told me that she didn't think the suggestions were specific enough. A bit interesting about that producer, she was the most enthusiastic about the survey, and also the one who I think had discussed it most with her vet. But she didn't think the suggestions in themselves were that useful. Where they discussed with your vet, really happy to see that they had discussed it with their vet. One of the producers who hadn't discussed it was going to discuss it at a later point. And we also asked if the changes were implemented, which again we are happy to see that the producers did follow some of the advice that the students gave. And would you prefer to receive feedback letters in the future? Of course, they all said yes, it is free. For the students, just to go quickly through this, we asked them if they could remember if the producer feedback contained some suggestions for herd health improvement. And I've got this picture of, you might not be able to see, but there are a couple of lambs there. Just to remind me that this includes the students who did inspection of sheep or goat, and we have a few who did on pigs. And we've got, actually, it's up to 89 replies so far. Most of them could remember that they had given some suggestions for herd health improvement, and again, most of them think it's useful for the producer. We also asked them if it was a useful learning experience for the student. Again, really nice to see this reply so far, and also that the difficulty they rated as medium. It's not too difficult, it's not too easy. I just hope they were honest on this one. So, conclusion so far is that producers really appreciate getting this information, and also that they are not aware that they are entitled to it. So again, legislation says the OV has to communicate this information back to the producer and the producer's vet. And in most abattoirs, it does get written down, but it doesn't reach the producer. There are some systems in place. In the UK, we've had something called Innova that some of you might be familiar with, which, as far as I know, it's not up and running at the moment, is available for cattle, pigs, poultry. It's used by poultry and larger pig producers, but for cattle it doesn't seem that the producers are aware that they can access this information and that they are entitled to it. For the students, we're really happy to see that the feedback, they believe that the feedback was useful, and also that more than 95% said that it was a useful learning experience for them. We, being student educators, especially in this sometimes challenging field of veterinary public health, they come to us at 7 o'clock in the morning to spend some time in a slaughterhouse. It's sometimes challenging to have them interested in this, and we are seeing some nice changes in how engaged they are with what we are trying to teach them. So really happy to see this. We are taking this further on this year, following up the producers from last year, hopefully trying to see if the suggestions that were given worked. And we are also taking this to sheep producers and pig producers, and that's a much bigger data set. So any comments or feedback would be much appreciated for this. And yeah, any questions?
Thank you, Dr. Prestmo.
Jennifer Gretsch, US. I was wondering if you have thought about maybe putting any like meat quality type feedback in there, because I know like in the US we have a big problem with dairy producers doing injections in the rump, which obviously then creates a lot of issues with meat quality.
Yeah, we do see in sheep injection abscesses, which do get fed back to the producer, and also sometimes bruising. The students often ask about grading carcass quality, and I tell them what I don't know. We don't have anyone who does that. They're free to try if they want to, based on what they've learned, to grade body condition score and also meat quality scoring, and send that back to the producer. But it's up to the student, really. We quite enjoy letting them make the decision. Do you think this is useful? And if they do, then please go ahead, as long as they make sure to explain, I am a student, this is an amateur opinion that I'm giving, but if they think it's useful, yeah, please go ahead.
Any other questions? Thank you, Dr. Prestmo.
Yeah. Let me just say thank you first, because I left this slide to all of the producers who took part. Some of them have spent quite a long time on the phone with, so many thanks, and also to the Abattoir staff, which have been really, really helpful in gathering all this data.
Thank you, Dr. Prestmo.